Hi, my name is Glacy, and this is my presentation on smartphones and social media using healthcare. Okay, so when you answer a cell phone or a text when you're working, that's one of the implications. I'm sorry. That causes a distraction, there is a drop in concentration, and you're going to stop whatever you are doing to look at that phone, which can generate human error, which is a risk of causing damage to the patient, leading to an adverse event. Also, texting pictures or any information about patients whatsoever is a violation of HIPAA, and some of the unethical issues that I chose are confidentiality issues, which is sharing personal information, distraction, and source of nosocomial infections. So, confidentiality issues. If a nurse uses a personal smartphone to communicate any information about a patient, that being a text or an image, the nurse could be violating federal laws, especially HIPAA, hospital security policies, and the ANA Code of Ethics, according to the website American Nurse Today. Also, by using a personal phone to share patient information, is completely against the ANA Code of Ethics. On provision number 3, it states that the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. Obviously, by sharing their personal information, you're not protecting their rights and even their safety. You never know in which hands this information is going to end up. According also to an article published by the website American Nurse, sending those private informations could lead to loss of employment, financial fines, jail sentence, and losing their license. I don't think it's worth it. So I'm originally from Brazil, and back in 2015 there was an unethical use of phones in a hospital setting. A TV host suffered an airplane crash, and a singer had a car accident in which he came to die on the scene. On those both cases, they were taken to the hospital and they took pictures of them being treated, including the guy who had just died. And they shared on this app called WhatsApp. It's like a Facebook Messenger, and it was everywhere within hours. So, distraction. Smartphones can impair cognitive performance. It reduces focus, therefore increasing reaction time and lowers performance of tasks needing mental concentration and decision making. So there was a survey, and a total of 1,268 participants from the Academy of Medical Surgical Nurses and the Society of Pediatric Nurses concluded that 69% of participants believe that the use of personal phones have a negative impact on patient care, as they can be very distracting at work. That's why they say don't text and drive. Why would you? Because it causes distraction. Why would you do that when working, And the same survey also reported the participants witnessed nurses using their personal phones while working, which led to medical errors and missing essential clinical information. So I could only imagine you trying to give report to somebody and the person is looking at their phone and you don't even know if they're getting the information that you're just telling them. So on this survey, 18.75% of the people who responded said that they use their phones during work to make phone calls, check and send emails and texts. And the other 15% said that they use their phones to post on social media. They also said that the participants are 10 times more, more likely to report their co-workers using their phones and how that affects them themselves. And many hospitals have policies on the use of personal phones, but it's usually not enforced, and it depends on the person's common sense to decide how they use it. And the third one is nosocomial infections. HAIs can contribute to high mortality and morbidity of patients. Mobile phones, which are also seldom cleaned, are often touched during or after examination of patients without hand washing, can act as a reservoir for transmission of pathogens. And there was a study conducted in Ireland which showed that 70% of the phones that were tested had bacteria that could cause infection. 96% of it was actually contaminated, and 15 had bacteria that could cause HAIs. So it is proof that healthcare workers' phones could serve a reservoir of pathogens that could be transmitted to the patients within the hospital. But not everything is bad. There are benefits of using of smartphones. That is real-time communication. Nurse, doctors, and other healthcare professionals, they were able to communicate in real time, which speeds care and improves the patient's recovery. It's a good for reference materials. They are easy not to only access the patient information, but also information about health conditions, procedures, etc. I personally love Apocrites and Davis Drug Guide because sometimes my brain just go blank and nobody knows everything. And also accuracy. Some apps can help nurses and physicians to maintain an accurate medical error of their patients and prescriptions. Sometimes you have the doctor who just writes whatever and you have no idea what that is. So these digitized documents thus reduces the chance of medical errors of prescribing something totally different. Uses of social media in healthcare. The virtual space is relatively new, so everything about it's still new as well. We need to think before posting something on social media because you're not exposing only a personality, but it's also about our image and reputation. In the end of the day, we are human, but we also are professionals. Pictures of injuries, fractures, and everywhere and other things, they have been vastly publicized and shared on social networks. And those networks, they can, if something goes viral, hundreds of thousands of people are going to receive it in a few hours. And it's not ethical for a healthcare provider to be taking pictures of patients when they are in the most vulnerable times of their lives. We have to be empathetic. We have to respect their modesty, privacy, and intimacy because they are human beings. It doesn't matter if it's an anonymous person or a celebrity. They need to be respected. So the first unethical issue is the break of confidentiality. Sometimes something very innocent as a picture, it is a break, it's a violation of confidentiality. So let's say that a nurse has a patient with ALS and he never said anything to anyone about his condition. He posts about it on Facebook, about his life hardships, and the nurse goes and makes comments about his condition of treatment. Everybody who sees this post is going to know what he has, which is a break of his confidentiality. So instance of inappropriate use of electronic media by nurses such as this having been reported to the board of nursing, which could lead to one losing their license. And any information regarding a patient should be only shared with their consent. So consent. Taking and sharing pictures on personal phones, it's unethical. It invades their privacy, and even if the family or the patient says okay, it's not valid. The patient should not have to worry about the information being shared with whoever. They have to trust their nurse in order to receive optimal care. If they don't, everything goes downhill. They will not disclose that information to this nurse anymore. Patient identifiers. When you post a picture of a patient, even if you don't put their name, but if you say their procedures that were being done, or their diagnosis, or the hospital name, or the unit they are, those can be used to identify a person. that is also a HIPAA violation and also violate their rights. That can lead to like the hospitals and the facilities being sued, and for the students, it could the person could be end up like being expelled from the nursing program. So the benefits of adequate use of social media. Nurses can use blogs to promote health-related endeavors and interests. They can become wellness experts, educate interviews about health, share information about the profession, and give advice. They also can connect with other healthcare professionals to cope with the stress from the job and looking to find degrees. I do use Facebook a lot, and I'm a part of, I don't even know how many nursing groups and nursing student groups, because actually I'm both. I'm a nurse and I'm also studying to get my RN, so the best of both worlds. I'm able to get help from experienced nurses and also help some newer students. So the American Association of Critical Care Nurses provide links to a variety of discussion groups where nurses can find answers to questions, communicate with other nurses, and also share information. So the entity roles, we have HIPAA, HITECH, and the ANA course of ethics. So the HIPAA is a legislation that was created to protect the personal health information, to make sure the patient's data are appropriately secured and the patients are informed of any breaches that might happen to their health data. So the HITECH, it was created to incentivize the use of electronic health records. The HITECH Act encouraged healthcare providers to adopt electronic health records and improve privacy and security protections for healthcare data. And last but not least, the Nursing Code of Ethics, according to the ANA, it is a guide to care on how a nurse should carry out their responsibilities on a consistent manner, and their ethical obligations to the profession. So the code is a role to provide guidance on how to manage ethical dilemmas, social and clinical dilemmas that might arise, and it has 4 principles: autonomy, beneficence, justice, and maleficence. And all those principles should always be applied when caring for their patients. And the legal consequences. A healthcare provider could face loss of employment and being sued by a patient if the PHI has been posted on social media or stored on a personal phone without consent. The person could delete the picture from Facebook or whatever, but if there is a server, if it's on the cloud, that information is going to be out there forever. And the use of social media creates a permanent electronic record that is likely discoverable in litigation. So the legal consequences goes beyond being sued. One could also go to jail. The civil penalties, they start at $100 and it goes up to $25,000, and the criminal ranges from $50,000 to $250,000. And depending on how severe is this violation, they could spend 1 to 5 times in jail. And some employees, depending on how severe is this violation, they just try to deal with it internally and reprimand the person, or they could also fire them. And that was it for my presentation. Thank you so much.